Welcome to Virtual Face-to-Face with President Bruce Jarrell. I'm Alex Lukowski, Executive Director of Media Relations. It's been just 51 days since Brandon Scott, born and raised in Park Heights, was sworn in as Baltimore's 52nd and youngest ever mayor. His 10-minute inauguration speech was upbeat, but it also contained a dose of reality. "I am not a savior for our city," he said. "No one is coming to save us. We have the ability to save ourselves, but we can only do that together." And Scott went on to lay out what he called a new way forward. Forget the ribbon cuttings and headlines. He said this term is about making sure that we're tearing down what doesn't work and laying a foundation brick by brick that allows the next generation to thrive. And he talked about making the city cleaner, safer, better educated, and more equitable. It's early yet, but so far he also seems refreshingly unconcerned about criticism over his decisions. Very soon after his inauguration, Scott cited rising COVID infection rates and issued a controversial executive order shutting down indoor and outdoor dining, and also indoor recreational establishments like bowling alleys and bingo halls. Last Wednesday, with the news that Baltimore's COVID positivity rate dropped to the lowest in Maryland, the mayor reversed that, allowing restaurants to open at 25% capacity indoors and 50% outdoors, with patrons limited to an hour. He also allowed some group exercise activities with 10 or fewer participants. There's been a lot more action at City Hall, establishing a mass vaccination clinic at the BCCC, capping fees charged by food delivery services designed to keep delivered foods affordable, but without causing so-called gig workers to lose their jobs, killing a plan by former Mayor Jack Young to lay off 60 water meter workers and replace them with an outside vendor in order to fix chronic billing problems. But of course, the bigger issues are going to take a lot longer. Before COVID, Baltimore already had two other health crises, gun violence and overdose deaths, each costing the lives of hundreds of residents every year and impacting so many more. "Baltimore, we must reimagine what public safety means for us," he said in that inaugural speech. "Gone are the days when we try to police our way out of problems. That strategy has not worked. It will not work." And I should also note that the mayor and police commissioner announced a more focused and engaging police strategy just yesterday. He may talk about that. So please welcome our guest, Baltimore City Mayor Brandon Scott. I also need to let you know this program is being recorded and will be posted on the UMB homepage, umaryland.edu. Later in the program, you'll have a chance to ask your own questions. You can write them down at any time in the chat area. Select Chat with Host. And when your turn comes, I'll open your mic for you, so you don't have to do anything, but speak up. Now let me introduce our host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex, and welcome, Mayor Scott. It's a great pleasure to have you here. In my 23 or so years here being at UMB, I believe that this is the first time that I can certainly remember where we've had a mayor of Baltimore speak directly to the UMB community. I thank you for that. It's a first, but I hope it's the first of many. As you know, UMB is in the middle of Baltimore. We consider it our home. We consider West Baltimore our neighborhood, and we've made a long-standing commitment to be an anchor institution to this community. And I think many of us feel that UMB cannot achieve its full potential unless Baltimore thrives as well. So for us to be most effective in our role as an anchor institution, it is extremely important for us to hear some of your hopes and aspirations for Baltimore. And I'm sure we share many of those hopes and aspirations. We want Baltimore to be safe, productive. Those of us who live here and those of us who work here want to be proud of Baltimore and see everyone in it reach their full potential. So as we have this discussion, I do have one ask of you, sir, and that is to make sure we hear from you directly. How can UMB fit into your hopes and aspirations? How can UMB maintain a dialogue with you? And how can we improve the human condition in Baltimore? If we accomplish these things, it'll be a very productive hour. So thank you for being here. Let me begin with our West Baltimore neighborhood, our neighborhood and our friends. From your point of view, what are some of the West Baltimore greatest needs? What plans do you have about that? And again, how can the city and UMB work together to improve the quality of life for residents there? Mayor Scott?
Yeah, thank you, Mr. President, and thank you again, and thank you to all of the UMB family for having me here today. This is the first, but it won't be the last time for sure that you'll hear directly from me as mayor. When you think about Baltimore City and the troubles that our city has, There is no place where that is more relevant than West Baltimore. But you also, Mr. President, also have to put that in the historical context for our city. You hear me talk a lot about Baltimore City being the birthplace of housing, redlining, racial segregation legislation, right? And the impacts of that is seen throughout our city, but more so in West Baltimore than anywhere. We have the poster child for in racial inequality in the highway to nowhere and the disinvestment that has happened there. What we need for the entire city of Baltimore, but West Baltimore specifically, is to start to, as I talk about, building the foundation of how we're going to work to systematically and purposefully undo those inequalities that our city government helped to create, forced to create. And we know the issues that we have there. We have the educational issues, right? Where we need to provide a 21st century education to every single young person and their family. We know that we're building our new 21st century schools. We know with the impending override of the governor's veto of the blueprint for Maryland's future, that we're finally going to have a school system that's fully funded, that we're going to reimagine the curriculum, that we're going to make more of our schools community schools, reimagine our CTE programming, and allowing the city to also do something that it has never done, and that's invest more of the city's resources into making sure that we're creating a positive education system for our young people. We cannot and will not shy away from the reality that violent crime is something that has continuously plagued West Baltimore and all of Baltimore for longer than I've been alive. But when you think about West Baltimore, you have to think about, again, this is no longer just going to be about policing, right? Yes, we will, as we announced yesterday, focus our police in the areas that they need to be, but also focus them on the people, the small group of violent repeat offenders, through a group violence reduction strategy where we will identify those individuals, go and work with our law enforcement partners, federal, state, local, to attack that in that way. But we will do something that the city has failed to do twice, Mr. President, and that's also bring the resources for people to change their life and do something different. We're going to be expanding the work and evaluating and involving the work about violence interrupters. We know our Safe Streets program works, but we have to now move to Safe Streets 2.0. As I would say, we also, now that we have appointed the first director for the Mayor's Office of Neighborhood Safety and Engagement, Shantae Jackson, because we are now going to have a comprehensive approach. Every agency, our health department can help in West Baltimore with the health disparities that we have. We know that the Employment Development Office can help as we create pathways to success for people and their families. We have to reconnect. We have people who are re-entering into our neighborhoods. We have to make sure that they're trained and ready. Every single city agency will be on deck. It says that all hands on deck if we work to make Baltimore a safer and more equitable city while valuing and prioritizing our youth.
Great, thank you for that. And I know many people here at UMB have been involved in quite a few of the different kinds of programs, particularly in West Baltimore, but not limited to. So please consider us a partner in those efforts to the extent that we can help. Of course, one of the things is health disparities. You already mentioned that. And of course, COVID has thrown a monkey wrench in all of this, hasn't it? Whoever planned on that? But certainly vaccination is on everybody's mind. At UMB and the medical center, we have been very busy with the priority to get our healthcare workers vaccinated. We've also done quite a few of the school teachers and staff in the schools nearby. I'm pleased to tell you that your health commissioner is visiting us Monday to tour our site and to learn about it. And we'll figure what happens after that site visit. I hope it'll be a good thing. You've stood up several centers for vaccination too. Could you tell us sort of how you think it's going in the city? And again, how can UMB help you in this effort?
Well, let me first thank UMB, all of our hospital partners, Hopkins, everyone who've been great with helping us throughout COVID-19 and with this vaccination. As you know, we've been working in partnership through the P3 as we're now talking and focusing about vaccine. We all know the reality. UMB and are struggling with it too. The number one thing about vaccine is that there is not enough of it. And we know that we now have a federal administration that's going to get more vaccine out and into the hands of us. And we'll be all working in partnership to get it out. I think we've done a good job so far. And now, hopefully, very, very soon, not now, but right now, as they say in the church, as we get more of that vaccine, we can do some more of that great work that we all have been talking about doing, the partnerships with you guys, the partnership with our community, the partnerships with our federally qualified health centers to get the vaccine to many more people in Baltimore, being mobile, the great partnerships that we're talking about developing in the city of Baltimore. But I want everyone to hear me that we are ready. Our partners at the hospitals and UMB, they are ready, but we have to wait at some point for the federal government to get more vaccine to the state, to get to us so that it's not so limited. But we are all ready, and we will be able to vaccinate and mass vaccinate people throughout Baltimore City as we build up and work through the challenges. And I'm excited to work with everyone to make sure that we're getting people vaccinated and keep people healthy.
Thanks for that. It's been a frustrating time for sure.
Yes, it is.
The University Medical Center and UMB, along with Hopkins, put together the convention center. That's been really, I think, a very effective effort. We're also in very much support for the M&T Bank Stadium discussions that are take place. What kind of hopes do you have for the M&T Bank Stadium vaccination center? How can it serve Baltimore's needs the best?
Well, listen, I'm sorry, Mr. President. Oh, no, we know that we need sites that can take masses of people, right? And we know that we're going to have it in places that people trust and they're familiar with. We know that there are two iconic stadiums at that complex, and M&T is one of them. Everyone in Baltimore knows where it is. Everyone in Baltimore is comfortable there, and we're going to do it. It's also accessible through public transportation and by car. You can get there by light rail. You can get there by subway. You can get there by bus, which we know transportation is an issue in Baltimore City. It's also close to the highways and the main roads there, but also because we know that we can get many, many people there. It's the most important thing. I'm extremely excited about it. This is why I reached out to the folks at the teams, but also to the governor to say, this is where we have to have one here, and looking forward to us being able to unveil it.
Yeah, I'm really glad to hear that. I want to get one more question, and then we've got a whole lot of questions from the audience lining up here. Sort of maybe my next or last question here is, the pandemic has been particularly hard on cities like Baltimore. Are there any particular things that you'd like to see the Biden administration do to help cities like Baltimore recover fully? And again, I always want to put UMB in the picture here. Are there ways that we can help with that?
Yeah, I think, let me first say that I am extremely excited to have a presidential administration under President Biden and Vice President Harris, who we know both have affinity for our city. Vice President Harris had her campaign office here, and we know that the president, through his years of riding Amtrak, knows Baltimore very, very well. But also they know the value that cities bring to our country, and they are committed, as you've seen in their first days of action, to the things that cities like Baltimore have been struggling with for far too much. So I have a laundry list, which many of their people know already, but I'll start here. First and foremost, we need them to continue to support residents, direct payments to our citizens, just like they have been in expanding it. Secondly, we need them to give money directly to cities to allow them to fill these budget gaps, to allow us to support institutions in our cities, our nonprofit institutions, also to allow us to have more direct support for our industries that have been hurt, like our restaurant and our bar, our entertainment industry, our tourist industry. We need them to do that while simultaneously generating things by focusing in on infrastructure things that we can do with a keen eye. And I know the acting secretary, Pete Buttigieg, is thinking about this on a keen eye of undoing, again, these historically, racially inequitable highways and transportation and infrastructure projects, so that we can generate this next generation of equitable transportation, equitable infrastructure in neighborhoods like West Baltimore that will put people back to work and help us build Baltimore not back, but better.
A lot of good suggestions there. We'll have to keep on their case, won't we?
Yes, we will. We will not. And we know, but I will be very remiss to say that when we know that our wonderful federal delegation, all of our senators, our congresspeople will do that. There is no delegation that is as connected, as dedicated than ours. I will put ours up against any across the country.
Gotcha. So, Alex, you've got a whole list of questions.
We've got a lot
of
we've got a lot of questions. Let's start out with Daryl Gray. Daryl, are you there? Oh, I unmuted. Remember, you don't have to do anything. I'll unmute you. Daryl, go ahead. Oh, that's the wrong one. That's Danielle. Daryl. Go ahead, Daryl. Well, I'll have to read the question. Daryl writes, I homeschool and I'm afraid of going back to school. I like homeschooling. I'm afraid to go back to school to get COVID and to bring it back to my high-risk parents. My parents have pre-existing conditions like obesity and diabetes. So what do you say to Daryl?
I would say, Daryl, that Daryl should have the right to stay home until that he feels safe and that it's safe for him and his family. We know that even when school opens back up, it's going to be in a hybrid situation. And we know that we're going to, from my standpoint, as the mayor who can help to, as we were talking about, and impact vaccine and impact those kind of things, we're going to work to make sure that we're doing that and prioritizing folks that are in our education frontline workers to do that. But we will always want people to be safe.
All right. But Daryl, let me add that there was just a CDC study that came out 2 days ago in a rural school with smaller classes, where there's a lot of strong evidence that could be done very safely with minimal transmission, less than the community transmission. Now, obviously, a lot has to be done in our public schools to meet sort of the standards in that article, but you should have hope that there are a lot of ways that you can make it safe to have school, be in school as well. The data is becoming pretty evident. Alex?
All right, let's go to Tricia O'Neill. Tricia, go ahead.
Good afternoon, Mr. Mayor, and congratulations. I also want to thank you during the presidential primaries for getting out and hitting the road. It's important to make sure that our voters are engaged. So I see that the Baltimore Health Commissioner has told the Baltimore Sun that she feels that 80% of residents will be vaccinated by the end of February, and you were challenging her, them, us to do better. But UMB recently provided a site for a live chat called Faith, Science, and Trust that featured Dr. Fauci and a number of Baltimore's religious leaders. Is that 80% of residents in total, or 80% of residents willing? And that's actually not the focus of the question to trick you in that way, but to say, does the city have any suggestions for UMB and the nation, in a way, of helping people who are reluctant to get the vaccine to decide to get the vaccine? We're a majority Black city, so if we know things, we should be out there helping others.
Yes, and thank you, Tricia, for that question. So, and we actually talk about this a lot. There is going to be an entire campaign. We know, listen, let's be open and honest here. This is Baltimore City in the United States of America, right? We know that this country has a history of practices that should have never happened when it comes to medicine in our Black and brown communities. We know that happened here in Baltimore City. We have to understand through this vaccine and any medical thing that we're talking about, that is something that we're going to have to address head on. That means honoring and owning up and knowing that really happened, that this is not a fairy tale that gets told in East and West Baltimore, that these things actually happen, but also to use credible messages. This is why we're talking about it. You look at the presentation that the health department and the P3 gave to the city council last night, having African-American doctors, having credible messages in the community, having other folks in the faith community, all these kind of individuals who carry weight, because it's not just about having medical professionals stand up there. These individuals, I know for me, right, I can't even go out and say that all of my family is going to listen to me, but they will listen to other folks who are much more versed in it, understanding the data and the science, understanding that there were Black people involved in the creation of the vaccine. We have to do all of that, and there will be a public campaign about educating people so that we can get people vaccinated.
Alex, next.
Okay, let's go to Lydia Watts. Lydia, go ahead. What's your question?
Good afternoon, Mayor Scott. How are you? I apologize, my camera isn't working, but congratulations. I'm not sure I've spoken to you since the election. My question is, as you know, as the executive director of the Rohr Center here at the University of Maryland, Baltimore, we are doing we are providing comprehensive services to victims of crime. And I would just love to hear, as part of your crime reduction strategy, how providing services for victims of crime fits into that matrix, since, as you know, so many people who are causing harm are also victims of crime themselves. And how do you see those services as part of your crime reduction plan?
Thank you, Liz. They're integral. And you and I was talking about this before. It's about looking at it from the totality, right? What we should be doing, what you do when you get those individuals who are the victims and trying to get them the help and resources that they need to prevent them from happening for them again, or, as you very well know, having them or their family or their friends do it to someone else in response. And what will be happening is that she is now 2.5 weeks on the job. Folks like yourself and others who are in the work will be hearing directly from Director Jackson about how we're all going to work together to break down these barriers and silos that we've had in this work, for us to be more integrated with the work, but also for communication and building up best policies and practices across the city to support that work. So I would just say hold tight for just a few more as she gets her foot on the ground. She has some big things that she has to tackle with building up the team, and they will they for sure will reach out to you, because your work is one of the things that I've already spoken with them about.
Thank you, Mr. Mayor. Alex?
Well, you know, we're always very proud to talk about the ways that we try to improve life in the city and life for city residents. So I want to bring in Kate Tofelsky, who wants to ask a little more directly. Kate, go ahead.
Hi, Mayor Scott. So which ways would you like to see the city partner with anchor institutions like UMB, and more specifically our new Community Engagement Center on Poppleton Street, which has recently been renovated and reopened? And if you haven't been out to visit it yet, we'd love to give you and your team a socially distanced tour if you can. But yeah, so how would you like to see us use the CEC for meeting the needs of our citizens through programming and services and other provisions?
Yeah, thank you. Let me respond first by saying, yes, please get me out of the office. If I do another Zoom today, I might go crazy. But please hurry, get me out of the office. Can't wait to tour. And Kate, it's really about what we also have to do, I think, for our anchor institutions, for the city government itself. We have to do a better job of communicating and understanding the need and meeting our communities where they are. I know you guys do a great job of that. We know what the issues are in our neighborhoods, and what we have to do again, Kate, is making sure that what your center is offering is meeting the needs of the folks in the neighborhood, Poppleton, you know, the folks at the homes, all the other places around there, so that we're helping that neighborhood become a better neighborhood from a sense of healing, dealing with mental health, dealing with substance abuse, dealing with opportunities for employment. We have to partner, and this is an opportunity for us also to partner with you guys, where we can have city resources there. People can come in and get connected. We have to be a more connected city, because we have all these great institutions, all these great things happening, but we have to do something that we have been unwilling to do, Kate, and that's tear down the silos, because we're all working to help the same people, but we have to communicate in order to do that best.
Thank you.
All right,
we'll be looking for you there soon.
All right, we have plenty more. Grace Brown is here. Grace, go ahead with your question.
Hi, Mayor Scott. Well, first, I just want to say congratulations. As a Baltimore City resident, I'm really excited to have you as our mayor. I actually met you a few years ago at the Parkway Theater when they were showing the documentary Charm City. So I just wanted to express my condolences on the passing of Mr. Dante Barksdale in his work with Safe Streets. I am a UMB Master Social Work student, so I'm currently working with a therapeutic foster care and have done a lot of work with Baltimore City Public School students. Thank you for passing the Elijah Cummings Healthy City Act. And as a social worker, I just want to know, how are you going to help address the intergenerational trauma within our city? And how are you going to involve social workers, if at all, with this process? How can I be more involved in this process?
Yeah, thank you. Thank you, Gracie. And good to see you again. It's been quite some time, and I'll hint out that there may be another documentary in the near future. So, but I will say this: one, it is my job now to implement the Elijah Cummings Healing City Act, which is something that I'm looking forward to enforcing. Just to break that out, the first phase of that I announced a few weeks ago is that we have to go and train all of our city workers to be trauma informed and understand how to do that. I made the decision that we're going to start with myself and the cabinet and go down from there, because if leadership is not doing it, we cannot expect everyone else to do it. So we're starting with myself. I think mine is actually next Monday, I believe, and we're going to start there. But then as we dig deeper into the issue and we get further and further along in the process, right? It's again about what I was just talking about. Okay, we have to make sure that we're aligning, right? So when we have our rec centers, for example, and our employees there trauma informed, right? Then they will understand, like, okay, these are the kind of partnerships that we need. We need to work with our social workers. We need to develop specific city plans for when there are incidents of violence and trauma in the family, that we're not waiting for folks to come to us. We should be going to them and saying, this happened. Allow us to be able to partner with these trained professionals. These aren't police officers. Our police officers are not trauma clinicians. You guys are trained professionals, allowing them to you guys to work directly with those families and the impacted, so that we can see the direct impact of how a trauma-informed care city works. But now I'm going to push us to get to that stage as quickly as humanly possible. We know that we're working on pilots and things like that, but right now, the most important thing for me to do is not skip any steps and start with the first thing required, which is the training.
Thank you. Alex?
All right, Alex Payne is here. Alex, go ahead. You've got sort of a two-part question, don't you?
Yeah, a bit. And thank you so much for appearing, Mayor Scott. I am curious because Baltimore needs to build its tax base and build businesses, but it also seems like it's developing the areas around the waterfront that are most vulnerable to climate change. So does your administration have any sort of thought process with its development strategy mitigate potential issues related to rising sea levels?
Yeah, Alex, I'm smiling because I knew I was going to get to the point where I had to say to someone that there's going to be a big report coming from me and my transition team that's going to directly address that, and I'm not supposed to give too many hints about that ahead of time. But I will say that simple answer is yes, Alex. There are ideas that I have and my team have about dealing with climate and sustainability in Baltimore City. Some of them are very, very big and ambitious. Some of them are simple things that we should have been doing, and you will see those ideas in the very, very near future. And I will leave it at that. But rest and assured that it is something that we're talking about, because it's going to impact our city. And I often talk about not just being different than the mayors before me, not just being a mayor for 4 years or as most people did it before me, 3 years to get elected in a fourth, but being a mayor for 4, 5, 10, 15, 20, 30 years, thinking down the line of what's going to happen when I'm no longer here, so that 20 years from now, someone who's sitting in this chair on a meeting in person, hopefully, does not have to every day uncover a decision that was made before they were born that should have never been made in the first place.
Well, we'll look forward to that report. Any idea when?
Now, between now and next Wednesday.
Oh, that's pretty soon. Good. We'll look forward to that. I welcome that. That's way overdue, as you're pointing out. Alex?
All right, I mentioned in the intro about your press conference yesterday and the announcement of the more focused police strategy. Well, Valerie Hughes has a question, but she still doesn't have a mic. She had this problem earlier today, so I'm going to ask her a question for her. She said, I've been studying your microzone strategy for fighting crime. I've lived in the city for over 30 years. I've lived through numerous crime fighting strategies imposed by previous mayors to fight crime, which failed. Now, I recall the microzone strategy like yours, wherein police were reallocated to higher crime areas. Now, that didn't work because the criminals moved to other areas, which increased crime in those communities. And one of those was mine. It took us 4 years to move them back out of the community. I fear that this will occur under your crime fighting strategy. How will you prevent criminals from relocating to low crime areas?
Well, yeah, thank you for your question. And let me be very blunt. No matter what strategy you have, the criminals are going to adjust, right? So it doesn't what you do. And remember that the microzone strategy is one part of the strategy. But I will say this, if I gave you a map of homicides in Baltimore City in 2020 and gave you a map of homicides in Baltimore and shootings in Baltimore City in 1993, you couldn't tell the difference. They happen in the same exact place over and over and over and over again. So we do know that a place-based strategy works, but the place-based strategy is only one portion. Remember, you also heard me talk about the focus on the people. People, places, guns, right? We also are going to be focusing in on those people. Those are the people that you're talking about being displaced. Those people who are doing the violent acts, involved in the activity that leads to the violence. It won't just be if they just move across the street or move to another neighborhood. No, the police department will be following them. This is actually one of the discussions that I personally had with the police department in this microzone strategy, because what I said was the way that the mayors before had them focused, if everywhere is a priority, nothing is a priority. Areas that should have never been on there. Listen, I love going to the Domino's at 41st and Falls. That is not an area that has ever had significant amounts of violence in the city, and having police resources there for that purpose was actually counterproductive because they should have been somewhere else focused on violence. So we will be focused on the people and the places, and they will follow folks and target them no matter where they are in the city when they're involved in violent activity.
Excellent answer. Alex?
It sounded like you were quoting Sun Tzu there for a moment. You know, if you defend everywhere, you defend nowhere. Was that what you were doing?
No, but someone else said that yesterday. I actually actually said that.
No, that's good, though. You're absolutely right. So unfortunately, Cynthia Pumphrey dropped out, but I'm going to ask her question. She was next. She's asking about the DPW employees. The wastewater plants recently have been reclassified to a lower level for vaccination, she says. I don't know if that's true, but you can address it. It's been documented that wastewater contains COVID-19 and employees have died from these wastewater plants. They should receive the vaccine at the same time as the sanitation workers, which is right now. Do you agree?
So listen, we are vaccinating our employees based on, again, I know all of us know the frustration here on this call, based on the guidance and what the state are telling who we can vaccinate at this time. We will vaccinate our first line employees as quickly as possible. I've made sure that the health commissioner knows that I want our folks vaccinated who are out there risking their lives in every way in our city, and we will vaccinate these individuals for sure.
And let me add that the state has been revising the list. It is a changing list, and so they are listening. That's a very good thing, and they need to hear people's comments and suggestions to continue to move that list. So thank you for that question. Alex?
All right, Stephanie Seworth has a couple of questions. Stephanie, if you're quick, I think you can probably get them both in there. Go ahead.
Hi, so the first question actually builds on the microzones. I'm wondering how you see that initiative maturing to be responsive to the focus on providing services and addressing some of those systemic racial issues that you had talked about.
No, thank you, Stephanie. That's actually the portion that's next that we're going to be talking about. That's one of the directions that Director Jackson has, because it's about not just the police, but the other agencies being involved there, right? Because those are the neighborhoods that we're having the illegal dumping. Those are the neighborhoods that we've seen, the redlining. Those are the neighborhoods that we've seen the lead paint and all these other areas of things that have caused many of these issues to have or happen. And that's the kind of focus that we're going to have there. It's not just going to be about the police. I want to continue to say this. There will be a role for them to have, but they are not. We will no longer put the full burden of violence in the city on one agency, because that was never the approach that we should have taken. Our health department, DPW, DOT, Rec and Park, schools, and our other partners outside of city government will play a role in that, and we'll be doing that kind of intensive work in those areas with our other agencies as well.
And that actually leads into the second question. You speak about the great institutions in the city, and we definitely have them. But there's been historically a lot of distrust between some of those institutions and our communities. What ways do you think the city and institutions like UMB and Hopkins can work together, not only to address the needs of our community, but to build the trust needed so that people accept our help and our services and try to improve, the quality of life in our city?
Thank you for that, Stephanie. I think, and this is something that I say to everyone, the first thing that the city, I always tell folks that I had to do it earlier today, the city, our partners, our institutions, anybody who wants Baltimore and regular citizens who truly wants Baltimore to truly be more, the most important thing that we all can be open and willing to do right now is be uncomfortable and vulnerable. For institutions, that means going in and accepting and talking to people and letting them tell you why they don't trust you, why they don't believe that you're actually committed to their neighborhoods. It also means that when you talk about equity and racial equity and that kind of work, you have to have people that are from that community involved in working in those institutions, so that culturally, the folks who are working for those institutions and pushing out those institution policies will do that with an understanding of what it actually feels like to be on the other end of that, and coming together and willing to do. I had to do that early this morning, as again I said to myself, and that's how you'll develop that rapport with our community members to begin to build that trust. This is Baltimore. No one's going to trust you overnight. It's not going to happen. You have to actually work at that, and you will not do that without putting yourself out there and consistently being able to build those bridges.
Gotcha. Thank you. Alex.
All right, let's put Genevieve Polk.
Hello, yes, good afternoon. Thank you again, Mayor Scott, for joining us today, and President Jarrell and Alex for this wonderful session. I just had a quick question, thinking about mental health. I know this is a big concern, not only in times of a pandemic that's impacting our children and our elderly in terms of isolation, but just in general, it's been an ongoing issue in our community. Can you speak to any initiatives that you've thought about to address mental health, especially in communities of color, and thinking about the youth in our city?
Yeah, this is a great question, Genevieve, and this is an area where I'm going to be coming to the experts. I know, listen, I'll always will tell you, I am not a mental health expert. I know that it's an issue, but I also am smart enough to know that there are people in organizations in Baltimore with much more information, knowledge, and also who are smarter than me. And what we'll be doing is bringing folks in to say, how can we deal with this issue through a culturally sensitive way, making sure that folks have access to the resources that are available, making more resources available for anybody in the city. And that's what we're going to be doing, because the city does not have to always be a direct solution, but we carry a big stick, and we can use the influence and weight of my office to impact how people are able to get the services that they need.
Great. Alex?
Okay, let's go to Hillary Roberts King. Hillary, a lot of people talk about this, we focus on the schools, but there are a lot more kids that aren't in school, right?
Correct. Thank you for the opportunity to ask this question. My name is Hillary Roberts King, as I said, and I'm the Executive Director of Downtown Baltimore Childcare, and we provide childcare in a nonprofit organization actually on the UMB campus. And my question for you, Mayor Scott, is we have seen a lot of initiatives to help families, but one of the biggest initiatives that's needed is support for childcare centers and organizations especially for families who are at the very beginning of their earning potential. Does the city have any plans for supporting these families and the centers that care for our very tiniest citizens?
Alex, I froze up for like 20 seconds there. I'm sorry. I'm sorry, ma'am. Can you say that last part?
Go ahead, Hillary. Ask the last part again.
I was just wondering that in the face of the pandemic, young families who are at the beginning of their earning potential, need help caring for their children so that they can go to work. What plans does your administration have to support child care centers and the organizations that serve these families?
Yeah, actually, thank you for that question, Hillary. That's actually one of the things that we've been talking up level about, like support that the city needs from our state and federal partners to support that so that people can go back to work. We're going to continue to do that, figuring out ways that we ourselves maybe can expand the support that we're giving here locally as well.
Alex, do you have one more?
We do have more. We have Pam Crow. Pam, go ahead.
Hi, Mayor Scott. It's nice to see you and have you participate in this exciting forum. I've lived in Irvington, Yale Heights specifically, for 37 years. And, you know, the same corner, Cedar Garden and Yale, just last week we had a really terrible shooting, and we don't even need to look at the location for the most part. We know where it is. Baltimore City has the sixth, if I have my data right, the sixth largest police force in the country and is number 30, I think, in population. Many of the BPD force live outside the city, sometimes even over the Pennsylvania line. And I just get the sense that they can't really relate to a lot of people that they deal with in the city. What do you think about creating an incentive for police officers to live in the city and even in the neighborhoods where they serve?
Yeah, thank you. Thank you for that, Pamela. And I know your neighborhood very well. Well, you can see I don't do that anymore, but when I got haircuts, my barbershop used to be at the corner of Frederick and Loudoun. So I spent many, many days and many, many hours in your neighborhood. And I will say, just for you personally, so you know this, that when we had those two incidents in your neighborhood back to back last week, I lost my mind because it's unacceptable for one to happen, let alone two to happen back to back without our folks being on top of that. So rest assured that they know that that's not acceptable and they have to be better. But one, let me be very open with you. We have some incentives that we offer now. We have a tax credit for our police officers. We have other incentives for them to live here. We're going to be expanding that. But we also are targeting our employment and recruitment, right? The applications from city residents and the hires from city residents have risen over the past few years. We're going to be more intensely focusing on that. But this is the key, especially when you think about it for my generation, right? When you think about it for many of us who grew up through zero tolerance and all the negative things that happened to young people, particularly young Black people in Baltimore, we have to rebuild that relationship with the community. What better way to do that and for us to actually home grow from a young age our police members? And what we're going to be working with our police department and our schools to do, there are young people in our high schools and CTE schools like Mervo, where I went, who have self-identified that they're interested in criminal justice and interested in law enforcement, just like we do for our fire department, where we have a program where you can go to Vivian T. Thomas and sign up for this EMT track, and you can graduate and go straight to the fire academy and be a cadet and go straight into being a part of our fire department. We need to develop the same exact thing, and we will for our police department, creating that cadet program, that pipeline straight from school to there. Because when you look at many of our officers who grew up in the city, even if they don't live here anymore, who grew up here, so many of them started out young, 18, 19 years old as a cadet first. We have to go back to homegrowing our police department and focusing in on building it in from within.
Mr. Mayor, thank you for that. I have a question for you, and I think the audience would recognize that you're a little younger than I am, but we've got the same haircut, I hear. You don't go to the barber shop, and neither do I. But my question is this. You've obviously risen through the ranks. You must have mentors. Who are the people that you look up to Who are the people that guided your development and career? Because you're a Baltimore guy, and look at what you've achieved now. What's the secret here for you? And what do we learn from that?
Well, I mean, the one that and the person that I miss the most is obviously Congressman Cummings. When folks talk to me about like my engagement with people and being seen and being able to touch, especially with our young people, they say, why? And I just simply say, I have no choice. The only elected official that came to my neighborhood when I was a kid was him. He was the only one. No one else came. No one else. I could touch no one else. And I want to be that and more, as he would say. Don't be me, be better than me, Brandon. Be that and more for the generations to come. But I'm also a historian about Baltimore politicians. And where in growing up, essentially being here in City Hall since I was 23, I had a lot of time to experience and be around a lot of them, right? So I try to take my tenacity. I take the tenacity. I would say that's a mixture of Mayor Dixon and Mayor O'Malley. I try to take my steadfastness, my willingness to do the right thing over the popular one from Mayor Rawlins Blake. I try to take the do it now fashion from Mayor Schaefer, from Governor Schaefer, try to be the mix and match of them all so that I can be the best representation for the city. And so that one day, some young person that I talked to on a Zoom during the pandemic of 2020 and 2021 will sit in this chair and be better than I ever was.
Maybe in the audience here today as well. So Alex, looks like to me we have 4 minutes. Let's get one more question because I know the mayor has a very busy schedule. So
I understand that, but I don't want to miss this one comment. Now, this person wants to be anonymous, but she writes, Mayor Scott, you helped me as a councilman, and you weren't even my councilman. I want to give you my full support and trust. I think you are doing a great job. I didn't want you to lose out on that one. So.
Thank you, ma'am. I'm always here to help.
All right, so Meredith Upton, I think you're going to get our last question. Meredith, go ahead.
Hi, thank you so much, Mayor Scott. I remember meeting you virtually at the City Center Residents Association introduction. So great to see you here. Congratulations. One thing that I'm really interested in hearing about is, do you have specific strategies that you've seen work well that break down silos inside government institutions like City Hall and also among institutions that need to partner together in order to effectively tackle an issue? Because I think we all recognize that we need to break down the silos, but then when you actually look at like logistically how to do that, it can be challenging. So I'm interested in hearing if you have some suggestions.
Yeah, thank you, Meredith, and good to see you again. I actually remember. I try to remember as many Zoom meetings as possible. I remember that one. But I will say this first and foremost, Meredith, breaking down silos in government. The first and most important factor of that is leadership. You have to have leadership that's committed to that and building that, right? And this is what myself, our city administrator, Chris Shorter, who maybe we can have on with you guys, who we're actually building that in together. That's why we brought him here, to make sure that every agency was communicating, working with each other. It's also about systems. I know, Meredith, you heard me talk about this on that Zoom too, that when you have the city agencies who have to work together, for example, if it's over our capital budget, right, and housing and DOT and DPW and rec and parks and planning, all of who are working from the same capital dollars are all using a different program, you're never going to have the interaction that you need, right? When you have those kind of systems that need to put in from data management, our 311 system, all of these kind of things, forcing people to do that. And the irony is that I actually, right before being on with you guys, I was on another Zoom with other mayors who are trying to help me out. And one of the things that I asked them about is about integration for accountability purposes. And many of them have systems that they have built that they'll be sharing with us. And what we'll be doing is continuing to mix and match the best practices and policies around the country and around the world, really, to fit here in Baltimore to make sure that we're breaking down those silos. But also it's about accountability. This is why we have restarted our city stats process to make sure that agencies are being held accountable together as well. And the last thing I'll say is thank you, Mr. President. Thank you, Alex, for hosting me here today.
And Mr. Mayor, thank you for being here. This was a wonderful session. We need to do it again. And for the audience, thank you for being there. I have a quote from Freeman Hrabowski: keep hope alive, because we're right in the middle of close to a solution here. So Thank you again, Mr. Mayor. Thank you.
Thank you. Thank you so much.
Okay.